Chagas disease, also known as American trypanosomiasis, is a parasitic infection caused by the protozoan Trypanosoma cruzi. The disease is spread by triatomine bugs, also known as kissing bugs, which are found in the Americas. Chagas disease is prevalent in Latin America, but cases have been reported in other parts of the world, including the United States. What is Chagas disease? Chagas disease is caused by the parasite Trypanosoma cruzi, which is transmitted to humans through the feces of triatomine bugs. The bugs are commonly found in the Americas, especially in rural areas. The disease can also be spread through blood transfusions, organ transplants, and from mother to child during pregnancy. Once the parasite enters the body, it can cause acute or chronic infections. The acute phase of the disease may last for a few weeks or months and can cause fever, fatigue, body aches, and swelling around the bite mark. The chronic phase of the disease can last for years or even decades and can cause heart and digestive problems. Causes of Chagas disease. Chagas disease is caused by the protozoan Trypanosoma cruzi, which is transmitted to humans through the feces of triatomine bugs. The bugs are commonly found in the Americas, especially in rural areas. The disease can also be spread through blood transfusions, organ transplants, and from mother to child during pregnancy. In addition, the disease can be spread through contaminated food or drinks, such as unpasteurized fruit juices or sugarcane juice. The disease can also be spread through contact with the feces of infected animals, such as dogs, cats, and opossums. Symptoms of Chagas disease in humans. The symptoms of Chagas disease can vary depending on the phase of the infection. During the acute phase of the disease, symptoms can include fever, fatigue, body aches, and swelling around the bite mark. In some cases, the infection may cause swelling of the liver or spleen. During the chronic phase of the disease, the symptoms can include heart and digestive problems. The heart problems can include an enlarged heart, irregular heartbeat, and heart failure. The digestive problems can include constipation, diarrhea, and difficulty swallowing. How is Chagas disease diagnosed? Chagas disease can be diagnosed through a blood test that looks for antibodies to the parasite Trypanosoma cruzi. The test can be performed by a healthcare provider or at a laboratory. In some cases, the parasite can be detected through a biopsy of the heart or digestive system. Imaging tests, such as echocardiograms or endoscopy, may also be used to diagnose the disease. Treatment options for Chagas disease. The treatment for Chagas disease depends on the phase of the infection. During the acute phase of the disease, antiparasitic medications, such as benznidazole and nifurtimox, may be used to kill the parasite. During the chronic phase of the disease, medications may be used to manage the symptoms, such as heart failure or digestive problems. In some cases, surgery may be necessary to repair heart damage. Prevention strategies for Chagas disease. The best way to prevent Chagas disease is to avoid exposure to the triatomine bugs that carry the parasite. This can be done by using insect repellent, wearing protective clothing, and sleeping in bug-free areas. In addition, it is important to avoid eating or drinking contaminated food or drinks, such as unpasteurized fruit juices or sugarcane juice. Blood donors and organ donors should also be screened for the disease. Chagas disease in the United States. Chagas disease is not commonly found in the United States, but cases have been reported in several states, including Texas, California, and Arizona. The disease is more common in Latin America, where it is estimated that 6 to 7 million people are infected. The relationship between Chagas disease and poverty. Chagas disease is often associated with poverty, as it is more common in rural areas where housing conditions are poor and access to healthcare is limited. The disease can also lead to economic hardship, as it can cause long-term health problems that can limit a person's ability to work or care for themselves. Chagas disease research and development. Research is ongoing to develop new treatments for Chagas disease, as well as vaccines to prevent the disease. In addition, efforts are being made to improve screening and diagnosis of the disease, especially in countries where it is more common. Conclusion: Chagas disease is a parasitic infection that is spread by triatomine bugs. The disease is prevalent in Latin America, but cases have been reported in other parts of the world, including the United States. The symptoms of the disease can vary depending on the phase of the infection, but can include heart and digestive problems. Treatment options for the disease depend on the phase of the infection, and prevention strategies include avoiding exposure to the bugs that carry the parasite. Ongoing research is focused on developing new treatments and vaccines for the disease, as well as improving screening and diagnosis. If you want to be healthy and safe, subscribe to the channel and push the bell button to help you change for the better, and please leave comments as you see fit. We meet in the next video. Thanks for watching.